Hello, everyone. Welcome to our next plenary session about meeting tomorrow's challenges or making the new normal the better normal. Our speaker today will be Igor Belokrinitsky. He's a principal of strategy at PwC. And Igor must have a crystal ball or something because the state of the world is changing so rapidly that I can't wait to hear what he says. Before we hear from Igor, we're going to show a very short video and presentation to tee up the conversation. So sit back and enjoy the video.
The COVID-19 pandemic is putting unprecedented stress on the international development ecosystem, including donors, recipients, multilaterals, and governments. But it is only the latest in a long line of challenging events. Against this backdrop, megatrends such as the accelerating pace of technology, increasing wealth disparity, and climate change are reshaping the world. What is needed are new approaches to ensure we achieve the promise of the United Nations Sustainable Development Goals by the year 2030. We will need improvements for healthcare systems, for cities fighting pollution and bettering transportation and mobility, and for educational opportunities for the growing youth population. In the context of addressing these massive challenges, we've been talking to our stakeholders within government and the public sector about what works and what will be needed going forward. Based on what we've learned, we've identified 5 areas for action to increase resilience within international development. First, improved alignment between strategy and funding, along with the development and deployment of innovative finance programs, will be needed more than ever as government budgets shrink. Next, deepening collaboration across sectors and agencies, including among donors, governments, civil society, and the private sector, will be vital to improving the consistency and effectiveness of interventions and balancing competing needs. Further, simultaneously addressing short-term crisis management and long-term preparedness requires building practical capabilities and digital skills in functional areas like management, operations, and financial and strategic risk analysis and planning. Next, institutions should seek out innovative approaches to service delivery, striving for greater impact. Digital transformations will help organizations become more agile and effective so that they can help deliver programs in line with donor aims and objectives. And finally, an increased focus on strong leadership and a building of trust. This means defeating corruption, fraud, waste and abuse at local, regional, national and international levels, with clear messaging to allay citizen concerns. The COVID-19 pandemic has intensified challenges in development, but it has also ignited new ways of working, new ideas and new possibilities. The opportunity for making the new normal be a better normal is real. And it is time to redefine the ambition for development.
Hi, everyone. My name is Igor Belokrinitsky. I'm a principal with PwC Strategy. And over the last 16 years, I've worked with about 60 different nonprofit health organizations to put great health within reach of everyone. And I saw something interesting this week. It turns out that 180,000 more people per year die of malaria than we originally thought, according to the World Health Organization. 180,000 more per year than we thought. And it made me wonder about 2 things. One is, how could we have been so far off on our estimates? And 2, perhaps more importantly, how do we continue to allow this to happen, especially when malaria prevention has one of the highest returns on investment in terms of lives saved compared to the dollars invested. And what it made me think about is that we have the passion and the will to make the change. We have the data, we have the resources. So what's missing? Why are we allowing these things to continue happening? And so it made me think about the need to make better decisions, higher quality decisions, more informed decisions, faster decisions, more equitable decisions. Now, the good news is we actually now have a lot more tools and the know-how and the experience to make these higher quality decisions so that we can take the necessary action. And today I wanted to talk about 7 developments that make me optimistic about our ability to make better decisions going forward. Our ability to create a digital twin or a synthetic population to test our decision. Our ability to set smarter goals to compare and evaluate different programs. Our ability to create more useful scenarios about how the future might transpire. Our better understanding of our cognitive biases so we can create higher quality forecasts and plan better. Our increasing ability to communicate information, particularly data, in a visual manner that makes an impact and drives change. Our relationship with our mentors that could help drive our decisions. And finally, an actual evolution in how we facilitate decision-making conversations so we can get to the consensus faster. So these are the 7 things that I wanted to cover in the next couple of minutes. First, I'm really excited that we're now more capable than ever in thinking about populations that we serve and that we try to bring new services to. And so, for example, at PwC, we've actually built a platform to create a synthetic population, to create a digital twin of any given population using their financial, healthcare, demographic, behavioral characteristics. So, for example, one of the data points that we have is afraid of needles. And was an important data point a couple of years back when we built this. It is a really important data point during these days of vaccine hesitancy. So if you have a reasonably high fidelity model, a digital twin of the population you're interested in, you will make better decisions. The second thing is setting goals. Now, having good goals allows you to compare different programs that sound good, but may have different impacts, allows you to report better. The new generation of philanthropists want to see the goals you're setting as well as the performance you're achieving. In healthcare, our conversation has been evolving from talking about social determinants of health, so things that impact somebody's health outcomes, to actually social determinants of life, helping somebody achieve their full potential, kind of top of the Maslow's pyramid, and have a great life. And a great health is a part of great life, but it's not the entirety of it. And then, of course, in the great Washington State, University of Washington has this global burden of disease methodology that we have found very helpful in setting objectives and setting goals for various interventions. And then you get, again, compare different programs in terms of the extent to which they relieve this global burden of disease. So a very useful tool for setting goals. The third thing that I'm very excited about is our increasing abilities to think in terms of future scenarios, both scenarios that we like and also scenarios that we would like to avoid. And it is very important to think about these scenarios both in qualitative terms, tell a narrative, tell a story about what could happen in the future, as well as in quantitative terms. And it's on this quantitative terms that there's been a lot of progress made, and we've moved from something as fairly straightforward as a Monte Carlo simulation to now AI-assisted agent-based modeling that lets us play out a whole bunch of different scenarios and multiple moves by multiple participants. And it's very interesting. I was looking the other day at a site of an organization that used to create various scenarios for the future. They actually have shut down. And I was looking at some of the scenarios they have built that cover our present day, our present era in public health. And it's sad and kind of comical at the same time how optimistic and rosy their scenarios are. And even their worst case scenario of our present day is actually quite nice compared to the reality that we're living through now. The next component that I want to talk about is visual representation of information. You know that every day there's more and more information coming at you. Your attention span is sort of disappearing and fragmenting, and yet you need to be able to process it all and understand it all. And we're sort of the weak link here, our cognitive capacity to absorb information. And so we need data visualizations that capture attention, that stick, and that people remember, and ultimately that prompt action. And so there are now a lot more tools, and it's a capability we all need to be building on how to get better at visual representation of information. My role model in this is Florence Nightingale. She created this amazing visual representation that completely changed the conversation on public health and hygiene and literally saved lives. So Florence Nightingale is your guide to visual communications that are effective. The sixth thing I wanted to mention is the role of mentors. As you look to make great decisions, all of you, I'm sure, are mentoring others and are hopefully fortunate enough to have great mentors that guide you along the way. But as the world around us changes, we may also look at our roster of mentors and make sure that we have the right set of mentors. Tyler Cowen, in his column this week, talked about how when it comes to crypto, you may need a mentor who is far younger than you, because your existing mentors may just not know as much about crypto and may not be ready to guide you in some of these newer areas of inquiry. And finally, one of the challenges we all have in making decisions is just how long it takes and how you keep going around in circles. And so we're learning a lot more about how, with weak consensus, we can make decisions faster, provided that they're well informed by all the things I've already mentioned. So there's a great organization right there in Washington State, a great retailer, whose motto and whose way of doing business is disagree and commit. And I found this extremely useful in meetings where, instead of asking everyone to think of the best possible outcome, you ask everyone, is this something that you can live with? So think in terms of synthetic populations and digital twins, set smart goals, think in terms of scenarios, consider different forecasting biases, think about visual representation of information, make sure that you have the right mentors, and be prepared to disagree and commit. And I think with all of those things in mind, you'll be really well positioned to make higher quality decisions, smarter decisions, faster decisions, more equitable decisions. And so I hope you enjoy the rest of the program and come away more equipped, more armed to make better choices for your organization and for the world. Thank you.